Hi, my name is Christine Ng. I am a student at Indiana State University. Today I will be teaching about asthma. The following learning objectives are: viewers will have learned the pathophysiology of asthma, viewers will have learned the etiology of asthma, viewers will have learned the signs and symptoms of asthma, and viewers will have learned the triggers of asthma. Viewers will have learned how to use an inhaler. Viewers will have learned the treatments of asthma. And then the pre-test and post-test is below. So we'll start with the pathophysiology of asthma. What is asthma? It's when sharp contractions of bronchial smooth muscle happens. It causes the bronchospasm, which causes the airway to narrow. The thin layer of muscle within the wall contract and it becomes tighter and narrower. The walls of the airways becomes inflamed and swollen. And in those with severe asthma, causes mucus production. It's really excessive and it can block the airways. There's ongoing inflammation, it can develop scar tissue, which result in thickening of the airway walls. So if you see in the bottom left, there's a picture of a normal airway. And then on the bottom right, you can see when a person is having an asthma attack. It's when there's constriction that happens and then extra thick mucus production happens as well. Then bronchospasms happen. So when the muscles tighten, there's a lot of inflammation causing the airway to be really narrowed. Etiology of asthma. It can affect both adults and children. Family history of asthma is common, but it's not sufficient enough for diagnosis. Prenatal tobacco smoking. So if your parents were, or if your mom was pregnant with you and she was smoking, that can cause asthma to your children. Compromised lung function, allergic sensitization. So there's an elevated total serum immunoglobulin E level when you have exposure to smoking or exposure to animals. Usually some inflammatory factors are like respiratory infections, work, if you work at like somewhere there's a lot of smoke, common allergies like dust, grass, plants, flowers, cats, dogs. Other triggers would be like tobacco, food, pollutants, temperature change, stress and emotions, exercise, or cold air. How to diagnose asthma. Most doctors use spirometry. It measures the estimate of the narrowing of bronchial tubes by how much you can exhale after a deep breath and how fast you can exhale. Peak flow meter, it measures how hard you can breathe out. Or you can do the methylcholine challenge. It's a known asthma trigger. It narrows the airways slightly when inhaled, and if you have a reaction to it, it means that you have asthma. Chest x-ray can help determine some abnormalities or some diseases. Allergy testing, nitric oxide. It's when you have higher than normal nitric oxide levels. It's when you show inflammation to the airways. Sputum eosinophils. They're present when you're symptomatic and will stain rose-colored dry. Provocative testing or for exercise or cold-induced asthma measures airway obstruction before and after performing a vigorous physical activity or when you take several breaths of the cold air. Symptoms of asthma. It's usually when you're short of breath, you feel some chest tightness, wheezing when exhaling, trouble sleeping due to shortness of breath, coughing and or wheezing attacks, which worsens when you have a respiratory virus. Treatment of asthma. So there's quick relief medications, which are also known as rescue inhalers. There's short-acting beta agonists, which is albuterol, levobuterol. There's anticholinergic agents, so there's like other bronchodilators, ipratropium, tiotropium, oral and intravenous corticosteroids such as prednisone or methylprednisolone. These medications are when you're having an actual asthma attack at the moment. So like if you're exercising too much or you develop an allergic reaction to something and you start wheezing, having that shorter breath, these will help control your breathing. Long-term asthma control medications, inhaled corticosteroids, so like fluticasone, propionate, budesonide, cyclosonide, beclomethasone, mometazone, and fluticasone furoate. There's leukotriene modifiers, so Montelukast. That one's a prescription. It's a little pill. It's usually for allergies. Combination inhalers like fluticasone salmeterol or budesonide formoterol, or theophylline, which is like Theo24. Or there's allergy medications. You can do immunotherapy or biologics. And like I said, for the long term, it's usually when you have the asthma disease, and so it just helps control it, your asthma, so that way you don't have as often of the asthma attacks. So now I'm going to teach you how to use an inhaler. First, you want to prime the inhaler. So you want to follow the instructions according to the medication. So some inhalers have the little canister that already comes with them. You just insert it into the puffer. And that one you have to shake really hard for about 10 to 15 times before each use. Some of them, it's already in there, like you don't have to put the canister in there. Some of them you have to put a little capsule. It's just different, so it's best to read the instructions for box, or when you pick up the medication from the pharmacist, ask them to show you how to use it. So you want to place the inhaler in your mouth, placing the lips around the mouthpiece to form a really tight seal. Slowly breathe in through your mouth and keeping a tight seal. And then you want to press down on that inhaler or cock it. And then you want to slowly breathe in the medication. And once you take out the inhaler in your mouth, you want to hold your breath for about 10 seconds to allow the medication to reach out to your lungs. Then you pucker your lips and breathe out slowly. Repeat the steps if another puff is needed. Because some inhalers, and depending on what the doctor prescribes you, usually just use one puff. Sometimes you use two. And then also some inhalers requires you to wash your mouth after taking a puff. It's really important that you do that. Some lifestyle changes to maintain or control your asthma is maintain good sleep and relaxation. You want to maintain your weight in a healthy range. You want to focus on a healthy diet lifestyle such as fruits, vegetables, and lean meats. You want to exercise daily. You don't want to, although you don't want to overexert yourself, because it does and can cause an asthma attack. You want to keep up to date with doctor's appointments. You want to take the medications as prescribed, especially the inhalers. Stay current with your vaccinations, and avoid smoking or exposure to smoke. Okay. And thank you. Here are my references. And then make sure you want to take the Postt test that's posted.